I hope you're having a great day. Well, today I want to talk about UTI in specific. We had several queries come in today over social media about UTI, that's urinary tract infection. And this is not just a problem with women and young girls, but it can even impact men. Now, what we need to understand is there can be two kinds of UTI. A UTI when you have a painful sensation while urinating and you get a little bit of pain and discomfort. And two is when you get a UTI accompanied with a fever, accompanied with body pain, especially in the flank areas and the sides, and sometimes accompanied with chills. Now, what we need to understand, there are simple tests that you can do, your urine test, and sometimes that shows a high level of WBCs, white blood cells. But what we want to look at is also the CFU count, which should usually be over about 1,000 on most parameters for a urine test. That is your colony formation units. So most women tend to already know when they get a UTI because from past experience, they can identify with the symptoms. Now, there are simple ways of handling this. Number one, what we need to understand is you need to constantly hydrate. You want to take in more water so that you can flush the infection out of your system. This is usually a bacteria. And this bacteria, when it creeps into the vicinity of your bladder, basically, for example, the E. coli bacteria, it starts sticking against the side walls of your bladder. And that's when your body's immune system raises, it tries to produce a fever to kill it, or it creates inflammation, which can be the pain that you see followed by chills. Now, what happens is when it comes to UTIs, usually you get antibiotics. Now, of course, if your doctor prescribes antibiotics, that's something that you want to go on and take. But what we should also realize is, if it's the grade 1 UTI where it's just the burning sensation and it's not too bad, you may not require antibiotics. If it comes along with the fever, the chills, and the body pain, you will definitely need antibiotics. But what you can do to try, the best natural method is, and I say all women should always carry this at every given point whenever they travel, because most of these infections are picked up when you use common public toilets, especially when you're on long flights and you use the airline loos. These are places where you can contract the infection very, very easily. So air hostesses, people who travel, people who use public toilets a lot, what you want to carry with you is something called cranberry. Now, I want to talk about a particular sugar which shares a close affinity to glucose, which is also a kind of sugar. It's called D as in Delhi, D as in Dumbo, D-mannose, M-A-N-N-O-S-E. D-mannose is a natural sugar. It's a naturally occurring sugar that has the same affinity to the glucose family. Now, D-mannose has been medically proven to help the E. coli bacteria to basically get out of your bladder, which means it has the ability to actually kill that. Now, D-mannose is found naturally occurring in things like cranberry, oranges, apples, peaches, and even green beans. So we get it in our diet, but when we have the UTI infection, it comes on pretty strong. That's why most women use something called a cranberry extract capsule. Now, you can get this, you can ask your professionals to prescribe this. It's available as an over-the-counter nutraceutical or a supplement. Cranberry is extremely effective when you have a UTI, which is why I always say it has naturally occurring D-mannose. Now, if you don't want to have cranberry, you also get D-mannose powder or D-mannose capsules. You find it on Amazon, you find it in nutraceutical shops, you find it in normal pharmacies and chemists. Because you can take up to 1 teaspoon or even up to a tablespoon 3 to 4 times a day to basically overcome your UTI, accompanied with a lot of water to hydrate. And so that's what you basically do for UTIs. You can manage it naturally, but again, that's not a replacement for your antibiotics if your doctors have asked you to take that for a specific reason. But carrying D-mannose or cranberry pills with you whenever you travel, especially if you're that person who constantly gets UTIs. If you constantly get UTIs, your body's also trying to tell you that you have a low immune system because your immunity is low, so it's unable to basically catch that infection quickly. People with poor gut health, a lot of bloating. UTI can also cause a lot of bloating. And the more and more antibiotics you take, the antibiotics basically wipe out all of your good gut bacteria. And then the more antibiotics you take every time you get UTIs, these bacteria basically become resistant to the antibiotics you're taking, which means your dosage has to increase over and over again. So every time you take antibiotics, you're basically depleting your gut bacteria. And now you have an imbalance. You have more of the bad bacteria and you have less of the good bacteria that your antibiotic just wiped out. So you got to make sure when you take antibiotics, you're on a prebiotic, you're on a probiotic, whether you get it from your food or from your supplements, that's your choice, or as per the direction of your professional, your medical professional. But it is so important that anyone taking an antibiotic takes a prebiotic and takes a probiotic to basically nullify, to the best of its ability, the side effect of what the antibiotic is going to cause. So when you have all of these bloatings, it's extremely important to understand that UTIs can be handled naturally. A second point for women, especially after intercourse, you want to make sure that you empty your bladder. So you want to finish intercourse and you actually want to sit down and you want to urinate. And the third thing is when you wipe yourself, it's always got to be in a movement from front to back, so that you make sure that no bacteria from the back gets into your vaginas. So it's a front to back wipe. You want to make sure that you empty your bladder post-intercourse. You want to make sure that you never hold your bladder full of urine for too long. Never hold on it. Always when your bladder's full and it tells you to go and urinate, you want to go immediately and do that, because you don't want to keep bacteria in your bladder for a long time so that it becomes an infection. So D-mannose, cranberry, whether it's in the form of fresh, it's in the form of supplements, these are things that women, especially air hostesses, they should carry this, because they get a lot of UTIs, and just popping antibiotics is not going to always, yeah, it will take away the UTI, but remember, you're going to get more and more antibiotic resistant, and then you're going to be prescribed with a higher dose of antibiotics. Have a great day, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.